Evaluation and comparison of 8-hour shifts versus 12-hour shifts in nurse burnout.
By Nikki Dixon in the MSN Administration track.
Corinne Fresco in the MSN Education track.
And Corinne Kier in the MSN Education track.
So we developed our PICO question based on our experience working at the bedside. I am a NICU nurse working at the bedside, working 12 hours. Corinne is in the ER working 12 hours, and Nikki is working in administration in the ER as well. We all have experienced burnout in coworkers, and we have also had interest in why or why not working 12 hours would be better for ourselves and for, again, our coworkers. So our PICO question is, for nurses, does working 8-hour shifts versus 12-hour shifts have an effect on nurse burnout rates? So the background of our topic and the interest of shift length and burnout for us stems from the nursing profession is notoriously demanding, requiring its members to maintain a constant peak performance physically, intellectually, and ethically. Burnout is a phenomenon characterized by reduced personal satisfaction, detachment, and emotional exhaustion. So anybody experiencing those symptoms cannot perform at peak performance as a nurse at the bedside taking care of their patients. Burnout is highly complex and it has developed into an endemic issue. If our nurses are experiencing these symptoms, how can they take care of themselves? How can they take care of their patients? How can they take care of their families at home? How can they continue functioning with those thoughts? In our research, we found that over the last 20 years, shift lengths have switched from 8 hours to 12-hour shifts as a way of offering greater continuity to staffing for days and through nights, and it's also more cost effective for the hospital, and again, providing that 24-hour care for the patients at the bedside. Also, we found that nurses stated preferences for longer shifts. They don't have to come in as many days during the week. It might provide a greater work-life balance, but it might still have the personal risks to health and patient safety that a nurse may not, divulge in a study because they like it personally to be away from the bedside a few more days a week. Our working definition of burnout for our paper was originally defined by Freudenberger in 1974 as a syndrome characterized by emotional exhaustion, depolarization, and reduced personal accomplishment. Any nurse experiencing, again, those kind of symptoms can't work at their peak performance, which again is going to hinder patient care. That's going to decline your patient satisfaction scores, as well as hindering nurse self-care, which again, you have a decline in job satisfaction for the nurses. Anybody working under those kind of conditions aren't going to help patient satisfaction, it's not going to help your coworkers, and it's not going to help the hospital as a whole. Through our research, we found that oftentimes longer shifts at the end of those shifts, specifically from the 3 p.m. into 3 a.m., there's a lot less management presence. There's also a lot less opportunity for education and training during those times of those long shifts. Without that support and without that training, again, there's more decreased patient satisfaction, there's decreased staff retention. The nurses are more likely to become frustrated, especially feel unsupported with that lack of presence and that lack of help, and unable to perform at their best. Anybody feeling those things that we described burnout as Freudenberger stated, can't perform at their best and can't support themselves nor their patients. So on this slide, we stated the reasons why we did our analysis, what it meant to us in the education and in the administration track. Nurses are continuing to leave. There's definitely still a nursing shortage. How much it costs just to replace one nurse, and not even just the cost of replacing a nurse, but what does that mean to the type of nurse that's at the bedside? If it's always new grads, if it's always a changeover, what does that mean for a unit and for a hospital as a whole? And then, the quality of care compromised to being continually new nurses. So one of our big questions would identifying controllable contributing factors make a measurable difference in the quality and retention of nurses and lead to individual and corporate benefits? So this worked all into our PICO question, and does shift length affect burnout?
So with this literature review aiming to answer the following question, are nurses in the acute care setting who work 12 hours as opposed to 8-hour shifts at increased risk of burnout? The population of interest for this review consists of nurse working in hospitals and inpatient settings. Our method was we searched CINAHL, Science Direct, Cochrane Systematic Reviews, and Medline. The phrases that we searched were shift length, 12-hour shift, 8-hour shift, nurse burnout, compassion fatigue, job satisfaction, mental health, and resilience. In order to identify scholarly work, we use limiters of peer-reviewed and full-text articles. This ultimately resulted in a total number of 12 articles. After independent review, 4 of those articles were eliminated based on low levels of evidence and indirect relation to the outcome of interest.
For our literature review, articles are discussed in the order of the value associated with their study design based on the levels of evidence. The first one with the highest level of evidence would be Bay and Fabry. This was a systematic review of 24 articles related to shift work and nursing outcomes. Although there were 24 articles, only 3 of these articles discuss the effect of shift length on nursing burnout. Another issue that could arise with this systematic review is that while the authors refer to we, they never explicitly confirm that a second researcher was selecting and appraising these articles. The samples were very different, which made it pretty difficult for the researchers to compare their results, leading to mixed results between the articles discussing burnout. In Ball's survey, they did a cross-sectional survey exploring the effect of shift length on self-reported care and nurse satisfaction. Overall, they had a very large sample size. This consisted of data from 2,568 nurses across 400 different wards in 46 hospitals through 12 different European countries. So this increases, obviously, the chances of multiple confounding variables among such a large sample size. In this sample, most nurses were working day shift, and nearly equal parts of the sample were working 8-hour shifts and 12-hour shifts. In the survey, the sections on job satisfaction, they were able to rate their job satisfaction as highly satisfied or a little dissatisfied, and this relies heavily on subjective interpretation of the meaning and value of satisfaction to each nurse. How do they define job satisfaction, and how do they even specifically define highly satisfied versus only a little dissatisfied? And with the survey, the researchers never actually mentioned any previous piloting or validation of the survey that they did use with this study. So overall, they did find a significant increase in job satisfaction was found among nurses working 12-hour shifts compared to nurses working 8-hour shifts. Lang performed a cross-sectional survey evaluating demographics and work-related demands related to burnout. This sample was taken from nurses at a military hospital. 52% were military nurses and 48% were civilian nurses. Most of the military nurses worked 12-hour shifts, and most of the civilian nurses were working 12-hour shifts. They used an inventory called the Maslach Burnout Inventory. This inventory has been previously validated and shown to be reliable when used in hospital settings, and also has shown to be reliable when used among military nurses. The MBI operationalizes burnout to include depersonalization, emotional exhaustion, and reduced personal accomplishments. So what they found was that shift length was related to significant decreases in perceived depersonalization among the military nurses, and it was nearing significance among the civilian nurses. This revealed a higher level of emotional exhaustion and depersonalization, mainly among the military nurses. In Dahl-Ora's cross-sectional survey, they evaluated the relationship between 12-hour shifts and burnout. They also used an extremely large sample that was spanning multiple inpatient settings across multiple European countries. They also used the MBI, which helped us in comparing their findings in our discussion section. In this sample, most of the nurses were female nurses working day shift and nurses that were working on a medical surgical floor. For this sample, most of the nurses were already working shifts that were less than 8 hours. And so what they found was that nurses working 12-hour shifts were more likely to experience depersonalization and lower personal accomplishment. Stimple used data that was collected by the American Hospital Association. So this is actually a secondary analysis. They used a cross-sectional survey measuring associations between shift length and nursing job outcomes, nurse-reported patient outcomes, and the quality of patient care. This sample included 3,710 pediatric nurses. Because this sample size was so large, data had to be adjusted to control for the influence of confounding variables, including individual nurse characteristics, nursing organizational factors, hospital characteristics, and the demands of unit acuity. Within this sample, only 3% of the nurses were working 13-hour or longer shifts, 71% were working 12-hour shifts, and 26% were working 8-hour shifts. They also used the MBI scale, but only the emotional exhaustion subscale. They were able to cite prior research showing that only the emotional exhaustion subscale was capable of independently predicting burnout. Overall, they found no significant differences in burnout between nurses working 8 and 12-hour shifts. For Chang, they used a longitudinal correlational study examining job satisfaction among Taiwanese new graduate nurses. They used the previously piloted clinical stress scale and job work environment nursing satisfaction survey. They measured with this survey at 3 months, 6 months, and 12 months, and they had an overall response rate of 56.8%, 50%, and then 36.9%. Most of the respondents for this survey were working on a med-surg floor and were working 8-hour shifts. Overall, they found that job satisfaction gradually increased from months 3 to 12, but a significant increase in satisfaction was noted among nurses working 12-hour shifts compared to 8-hour shifts at month 3. Although they were unable to make any generalizations about burnout without further research on the interplay between burnout and job satisfaction. Webster used a mixed method design exploring the introduction of 12-hour shifts to an Australian ICU where 8-hour shifts had previously been the norm. They developed a 49-item questionnaire and had this questionnaire reviewed by an expert in questionnaire design, although they did not do a pilot study with this questionnaire. The nurses completed this questionnaire in 2 different phases. In phase 1, it was while the nurses were still operating under 8-hour shifts, and then again in phase 2 after they had done 12-hour shifts for 6 months. Overall, they found that 12-hour shifts did have a positive effect on the retention and morale of staff and a significant improvement in the staff satisfaction. Harris performed a literature review using a broad range of inclusion criteria related to 12-hour shift work. This search was done and appraised by 2 independent researchers. They found that 8 articles measured psychological outcomes such as burnout and stress, and 17 articles related to job satisfaction. Although less than half of all of the studies appraised by Harris used validated assessment tools, which unfortunately calls much of this data into question. The authors concluded that while burnout is a complex phenomenon experienced by many occupations employed in shift work, there was insufficient available evidence to determine whether shift length antagonizes burnout in nurses.
So our next slides provide the synthesis and comparison of the articles that we looked through. All of our articles did address the topic of shift length, so 8-hour shifts versus 12-hour shifts. They differed in how they measured the impact of shift length. So not all addressed burnout specifically, and we'll go through and talk about the things that they did were similar and how they were different. 3 of our articles focused on burnout specifically, as well as other topics. Bay and Fabry focused on the broad topic of nursing outcomes with burnout. Del Ora included job satisfaction and intention to leave the nursing profession. Lang included depersonalization, emotional exhaustion, and reduced personal accomplishment, which are all part of our definition of burnout that we use throughout the paper. Through our analysis, we found similarities through specificity of research. Ball et al. Analyzed self-reported quality of nursing care and job satisfaction related to 12-hour shifts. Similarly, Stimpfel analyzed specific topics through self-reporting. It looked at nursing job outcomes, patient outcomes, and safety and quality of patient care. Through our analysis, we found articles that were very broad compared to very specific. The broad inclusion criteria that Harrison used hindered their ability to draw competent conclusions, as where Webster was much more specific, not only in their sample size, but also in their purpose and intention of the assessment that was conducted. Similarly, Chang was also very specific, with a very small sample size and a very specific purpose and intention of the study. The articles analyzed did truly vary in the way they measured the impact of shift length. Direct correlations between the specific topics addressed of all the articles were rare, further adding to a complexity of any comparisons of all of our articles. So these articles below specifically analyzed long shift length and the effects on the nurses. So Bay and Fabry, both they found how hours negatively affected the nurses' health and patients' outcome. Del Ora found that nurses suffered more emotional exhaustion, high depersonalization, and low personal accomplishment. And Lang showed that nurses were moderately burned out based on depersonalization and emotional exhaustion. So some are repeated and some have like very non-specific themes, but they were difficult to compare because they had some repeated, but not all the time and not in the same way. As our analysis continued, we did see some agreement in Ball and Del Ora that self-care did decrease, as well as a feeling of poor decrease in quality nursing care as shift length increased. But Lang's group found no change in feeling of personal accomplishment. Although it was at times seeming easy to find a theme that shift length did, as it increased, affect burnout, we did find some that showed the opposite. With Webster, there was a unanimous agreement among staff members that 12-hour shift would have a positive effect on staff retention. It would prove more flexibility and morale. Similarly, Chang found as shift length increases, so would job satisfaction. It was difficult, however, to compare these two articles, even though their themes were more similar than the others, because of the high specificity Chang had. It was just new graduate nurses in Taiwan, and so it could not be applied to a bigger population. Some opposing themes to our analysis throughout the process we found in Stimfel. They found no significant difference in burnout between 8-hour shifts and 12-hour shifts. There was a significant increase in burnout for past 13 hours, but that was not the focus of our analysis, but is interesting moving forward. And there was a 36% increase in intent to leave in 12-hour shifts compared to 8-hour shifts. So again, no specific mention of burnout, but intent to leave, but why, and that would, instigate and need for more research. Harrison found insufficient evidence available to determine whether shift length truly antagonizes burnout in nurses or not. The common themes that we could deduce after our analysis did show a negative correlation between extended shift length and nursing perception, whether it be through burnout, exhaustion, depersonalization. Nurses reported a decrease in job satisfaction, but reported a better work-life balance. But our most important theme that we discovered is more research is needed. We need more diverse populations and studies, more longitudinal studies, a focus and incorporation of more confounding variables, night shift, day shift. Just a lot more research is needed, because even though these themes may seem common, it was still hard to make real true comparisons between all. As stated before, this slide is limitations in our studies and part of our recommendation moving into our discussion about what we need for the future, for future research, confounding variables, structures, and why some of our articles may not have been able to be applied to other because of external validity and things like that.
While the results of the analyzed articles differed, they did provide a theme of negative correlation between extended shift length and nursing perception. All of these articles concluded that the topic merits more research because of its complexity and incorporation of numerous confounding variables. Researchers suggested that in order to account for these difficulties, future studies would benefit from the inclusion of diverse populations in study structures. Nursing preference was a frequent and problematic confounding variable that was mentioned in almost all of the articles. Similarly, studies agreed that while nurses reported decreased job satisfaction when they worked longer hours, they also reported a better work-life balance. That was usually explained as a result of having to work fewer days per week, despite the effects that longer hours may have had on personal health while working the 12-hour shifts. Studies also frequently reported confounding variables due to the practical limitations of their research. Demographic imbalances, including sex, age, and night shift versus day shift, were often difficult to overcome. Study structures including longitude and data collection technology could also present some problems. Bias was the most common limitation related to self-reporting of the data. External validity was also commonly questioned, as many of the studies were conducted with specific age groups and could not reliably be applied to a larger population. There is ultimately insufficient evidence to make any conclusive generalizations about the effects of 8-hour versus 12-hour shift patterns and the phenomena of burnout in nursing. While findings seem to suggest that there may be beneficial trade-offs between different schedules, it isn't possible to delineate how these schedules contribute to either measurable benefits or unacceptable risks to nurse burnout. One explanation of this lack of certainty stems from the apparent complexity of the burnout phenomenon. Because burnout is highly complex and is comprised of multiple variables that respond differently to the pressures introduced by different shifts and schedules. Per these articles, the emotional, physical, and personal components of burnout do not always directly correlate to one another. Future research may benefit from a redefinition of burnout, or an acknowledgement that burnout is too complex a phenomenon to be measured holistically. Our study highlighted a clear need for additional longitudinal studies focusing on the relationships between nursing outcomes and shift hours. To investigate the causal relationship between nurse work hours and outcomes, longitudinal studies with multiple observations are essential. We recommend that nursing organizations initiate and fund more research on nurse burnout, and that nursing leaders continue to monitor the nurse practice environment, demands placed on nurses, and staffing gaps closely. These studies demonstrate a need for proactive support and thoughtful policies for nurses who work any shift. Leadership support may also help with staffing gaps that place nurses in a longer than expected shift and could mediate potential added stressors of patient load. Administrative teams could also support nurses by implementing rules that ensure timely breaks and limit or eliminate mandatory overtime. Administrators aiming to increase staff retention could assess the feasibility of offering flexible shift lengths. Nursing educators and administrators alike need to lead the way in searching for solutions in preparing and retaining nurses.
And this is the final slide with the references used of the studies included in this presentation. If you have any questions, you could email us if you want to know more about any of the specific articles. Thanks for listening.